Hello everyone. In this lecture, we are going to study about apoptosis. Apoptosis, like necrosis, it is also a type of cell death. However, in contrast to necrosis, it is highly organized and it is also programmed. Okay, so apoptosis is a type of programmed. It's a type of programmed cell death. Okay, so that means the cells which are destined for apoptosis, they are going to activate some intracellular enzymes, and those intracellular enzymes are going to help in the process of apoptosis. If you see here, this is a normal cell, and this cell is destined for apoptosis. If it is destined for apoptosis, it is going to activate intracellular enzymes. Those intracellular enzymes are known as caspases. These are known as caspases. Okay, so as you can see here, this cell has already activated the caspases. So now let us understand what is caspase. So caspases are basically, it is named from two things. The C is coming from the cysteine residue. So basically these caspases, these enzymes, in their active site, they are going to have cysteine residue. Okay, and these enzymes can only cleave the polypeptide chain only after the aspartic acid residue. So if you see, this is a polypeptide chain, and this is one aspartic acid residue. Aspartic acid residue. This is another aspartic acid residue. Now these caspases can only cleave this polypeptide chain at this site and this site. That means just distal to the aspartic acid residue. So that is why the name caspase. Okay. Now, how these caspases can be activated? There are two mechanisms by which they can be activated. The first pathway is the intrinsic pathway, in which there will be increased permeability of the mitochondrial membrane. And the second pathway is activation of certain cell membrane receptors. These receptors are known as the death receptors. Okay. The first pathway is known as the intrinsic pathway or the mitochondrial pathway. The second pathway in which the death receptors are activated, that is otherwise known as the extrinsic pathway or the death receptor pathway. Okay, so basically the cells which are destined for apoptosis, they can either activate the intrinsic pathway, they can also activate the extrinsic pathway, or there can be activation of both the pathways. Whatever may be the pathway, ultimately they are going to activate the caspases, and this caspases is going to further activate various proteases and also DNases or endonucleases. Okay, so these proteases are going to cause proteolytic degradation of the cytoplasmic organelles, and the DNases or the endonucleases, they are going to cause destruction of the nuclear material or the chromatin. Okay, so as you can see here, in this cell, there is digestion or proteolytic degradation of the cytoplasmic organelles, and also there is chromatin material digestion. So what are the consequences? So because of destruction of intracellular contents, the size of the cell is going to reduce. Okay, so the first point, the first morphological point about apoptosis that you have to remember is reduction in the cell size, which is also otherwise known as the cell shrinkage. Cell shrinkage. The next thing that you can appreciate here is now this cell is full of eosinophilic material. So basically this proteolytic degradation is going to cause production of, multiple peptide chains. It is going to, the proteins after degradation, they are going to form peptide chains, and those peptide chains will be filled inside the shrinkage or shrinked cell. So basically this cytoplasm will be full of proteins or degraded proteins, and these degraded proteins are going to give a eosinophilic appearance to the cytoplasm. So along with cell shrinkage, you are going to find increased eosinophilia. Now let us focus on the nucleus. Inside the nucleus, there will be chromatin condensation and chromatin degradation. Okay, and this fragmentation of the chromatins, will cause localization of these fragmented chromatins at the subnuclear membrane location. Okay, so as you can appreciate here, you can appreciate that the chromatin materials, they are settling just below the nuclear membrane, So basically there will be chromatin condensation, and fragmentation. chromatin condensation and fragmentation, and they are going to have a subnuclear membrane location. They can also be randomly organized, but many times you are going to find this subnuclear membrane location. Okay, and ultimately it is going to cause nuclear fragmentation. It is going to cause nuclear fragmentation. Okay, so these are all important points about the consequences of activation of the caspase. The next thing is, as you can appreciate here, there will be formation of cytoplasmic blips. There will be formation of cytoplasmic blips, as you can see here. So these are all cytoplasmic blips, and these cytoplasmic blips, they are nothing but some portions of the cell membrane which is coming out of the cell, and this cytoplasmic blips are also going to have cytoplasmic degraded proteins and certain degraded organelles, and also sometimes they can also carry some of the nuclear fragments. Okay, and gradually these cytoplasmic blips, they are going to fall off from the original cell. Okay, and once they fall off from the original cell, they are going to form these apoptotic bodies. Okay, so these are known as the apoptotic bodies. Okay, so this thing is very important to understand, because this is the reason behind the name apoptosis. Apoptosis means falling off. Okay, so if you write here, apoptosis is falling off. So basically these apoptotic bodies, they are going to fall off from the original cell. That is why the name apoptosis. Okay, and once these apoptotic bodies are formed, they are going to make, there will be some alterations in the membranes of the apoptotic bodies that can be easily identified by the activated macrophages. So basically, the macrophages can identify these apoptotic bodies, and they are going to come and they are going to phagocytose these apoptotic bodies, and they can ultimately destroy these apoptotic bodies. Okay, so this is the entire process of apoptosis in a nutshell. But during this process of phagocytosis of apoptotic bodies, we have to remember two very important and unique points. What are those 2 points? The first point is, this process is very fast. Phagocytosis of apoptotic bodies, it is a very fast process. And the second point is, inflammation is significantly less, or you can say inflammation is absent during this process. Usually when the phagocytes are activated, when the macrophages are activated, they are going to produce various cytokines, and when they engulf, they phagocytose the cells, they are going to produce more and more cytokines which cause inflammation. However, this is a unique condition in which phagocytosis of apoptotic bodies are not going to produce inflammation, or the inflammation is characteristically absent for apoptosis in contrast to the necrosis. Okay, so these are the 2 important points that you have to remember about the phagocytosis of apoptotic bodies. Okay, because of these unique features, there is a different name given to this process that is known as efferocytosis. That is known as efferocytosis. Okay, so this unique form of phagocytosis that we're going to find in case of apoptosis, that is known as efferocytosis. So these are all the important points about the apoptosis in a nutshell. Now we'll discuss in detail about the process by which the caspases are activated. I will also discuss how the phagocytes, how the macrophages are going to identify these apoptotic bodies and causing the efferocytosis. Okay, but regarding morphology, we have to remember the point. The first point about morphology is the cell shrinkage. The first point is cell shrinkage. The second point is increased or intense eosinophilia of the cytoplasm. The third point is chromatin condensation and fragmentation and nuclear fragmentation. Next point is cytoplasmic bleb formation. Next thing is apoptotic body formation, and the last one is efferocytosis. Okay, so if you see under microscope, if you see it under microscope, you can see here this is actually a liver biopsy specimen, So basically, this one is a apoptotic body. This is also apoptotic body. Okay, so all these eosinophilic cells are apoptotic bodies. Okay, you can appreciate that these cells are shrinkaged. These cells are smaller compared to the normal cells. Okay, so these cells are smaller, and also there is intense eosinophilia of these cells. Okay, so there is intense eosinophilia, and also one more point you can identify that these cells have some kind of cytoplasmic clearing surrounding them. Okay, so basically, as they shrink, they're going to detach from the nearby structures. So that is how, that is why sometimes you can find some cytoplasmic halo surrounding these apoptotic cells. Okay, so basically, apoptotic cells inside the liver, these are characteristically described in patients with viral hepatitis. Okay, in patients with viral hepatitis, we are going to find numerous apoptotic bodies inside the liver. Okay, and these are known as Councilman bodies. Okay, so these are known as Councilman bodies. Okay, so the apoptotic bodies inside the liver that are found in viral hepatitis are known as Councilman bodies. We will discuss it again under liver pathology section. Okay, and because of this DNA fragmentation, okay, as I have told you, the DNA in apoptosis there is going to be DNA fragmentation, and because of this DNA fragmentation, you should do DNA gel electrophoresis. This is nothing but a DNA gel electrophoresis. In this, you are going to find a very characteristic pattern that is known as step ladder pattern. Step ladder pattern, or sometimes known as only ladder pattern. So as you can see here, this is actually normal. The second one is of a patient with apoptosis, of a cell with apoptosis, and you can appreciate that there is fragmentation of the DNAs, and that is producing the characteristic step ladder pattern. The third one is depicting about necrosis. In necrosis, we are going to find the smearing pattern. Okay, so step ladder pattern in the DNA gel electrophoresis is characteristic for apoptosis. Okay, it can also be found sometimes in necrosis, but for exam purpose, the answer has to be apoptosis. Okay, now we'll discuss in detail about the intrinsic pathways and extrinsic pathways. First, let us start with the intrinsic pathway. As I have told you previously, intrinsic pathway is otherwise known as the mitochondrial pathway. That means mitochondria is going to play a huge role in this pathway. If you see this diagram, the first one, this one is a normal cell. This one is a normal cell. And in the second cell, there is activation of the intrinsic pathway. Let us first understand what happens normally. Normally, when there is survival signals, whenever there is survival signals, as you can see here, this is a survival signal. If there is a survival signal, the cells, they are going to activate certain anti-apoptotic proteins. Okay, so they are going to activate certain anti-apoptotic proteins. So what are those anti-apoptotic proteins? There are three important ones. The first one is BCL2. The second one is BCL-XL. And the third one is MCL1. Okay. So BCL2, BCL-XL, and MCL1, these are the anti-apoptotic proteins. Okay, these are anti-apoptotic proteins. Actually, all these molecules, all these anti-apoptotic, pro-apoptotic molecules, many of these molecules are grouped under the BCL2 family. Okay, so they are grouped under BCL2 family. BCL2 family. This BCL2 family, it is going to have four important domains. It is going to have four important domains. The first one is, it is named as BH1, BH2, BH3, and BH4. Okay, so BCL2 family is going to have four important domains. These are known as BH1, BH2, BH3, and BH4. BH means BCL2 homology. Okay, BCL2 homology 1, 2, 3, and 4. These anti-apoptotic proteins like BCL2, BCL-XL, MCL1, they are going to have all the four BH domains. Okay, so they are going to have BH1, BH2, BH3, and BH4. That is why these are known as the BH1 to 4 proteins. Okay, So these anti-apoptotic proteins, these are known as BH1 to 4 proteins. So what is the function of these proteins, these anti-apoptotic proteins? Actually, these proteins are present on the mitochondrial outer membrane. As you can see here, they are present in the mitochondrial outer membrane, but they can also be found in the cytosol. I mean, they can also be found in the cytosol, and also they can also be found in the endoplasmic reticulum. Okay, but their predominant function is in the mitochondrial outer membrane. So what is that function? Basically, they are going to prevent, the release of cytochrome C from the intermembrane space out of the mitochondria. Okay, so as you can see, the cytochrome C, these proteins are present in the intermembrane space. If you see the structure of mitochondria, it will have a outer membrane and it will have a inner membrane, and this inner membrane will throw multiple projections into the mitochondrial parenchyma, and these projections, these are known as the crista of the mitochondria. Okay, so between this inner membrane and the outer membrane, you are going to find the intermembrane space. In this intermembrane space, you will find the very important protein that is known as cytochrome C. You must have studied in the electron transport chain that cytochrome C is a very important structure, which is a part of electron transport chain, which helps in production of ATP. Okay, so basically cytochrome C helps in production of ATP. And this cytochrome C, they have a tendency to come out of the mitochondria, which is actually detrimental for the cell. Because if cytochrome C will come out of the mitochondria into the cytosol, they are going to activate the intrinsic pathway of the apoptosis. And this release of cytochrome C out of the mitochondria is prevented by these anti-apoptotic proteins. These are known as the BCL2, BCLXL, and MCL1. These are grouped under the BCL2 family of proteins, and they will have all the 4 important domains of BCL2 family. Okay, these are known as the BH domains or the BCL2 homology domains. Okay, so that is why these 3 are known as BH1 to 4. Okay, and I have told you these anti-apoptotic proteins are also found in the cytosol and endoplasmic reticulum. Now we are going to see how this intrinsic pathway can be activated. For example, the survival signal is not present. If you see the second cell, this cell, there is no survival signal. Okay, so survival signal is not there, and there are certain DNA damaging substances. For example, radiations or certain kind of mutations. These are going to damage the DNA. Okay, and because of this damage, now this cell is going to activate its intrinsic pathway. But what is the exact mechanism? If the cell doesn't have the surviving signal and it also has some radiation damage or some kind of stress related damage, it is going to activate certain pro-apoptotic proteins. But before that, there will be some sensors. So what are the sensors which are going to identify that the cell doesn't have survival signal? Those sensors are, if you see the examples, these are BIM, BID, BAD, PUMA, and NOXA. Okay, so these are the 5 examples. The 5 proteins that you have to remember. These are nothing but these are the sensors. These are the sensors. They are going to sense that the cell doesn't have a survival signal. And once they sense that this cell doesn't have survival signal, this cell has to undergo apoptosis. They are going to activate certain pro-apoptotic proteins. So what are the pro-apoptotic proteins? There are 2 important pro-apoptotic proteins. Those are BAX and BAC. Okay, so the sensors, those are BIM, BID, BAD, PUMA, NOXA. These are the sensors. Once they sense that the cell doesn't have survival signal, they are going to activate certain pro-apoptotic proteins. Those are known as the BAX and BAC. One more thing you have to appreciate here, that these sensor molecules, these sensor proteins, they have only the third BH domain. They have only the third BH domain. They do not have BH1, BH2, and BH4. That is why these sensor proteins are known as BH3 only proteins. These are known as BH3 only proteins. Okay, and if you see the pro-apoptotic proteins, these are BAX and BAC. They will have BH1, 2, and 3. So that is why these are named as BH1 to 3. Okay, so anti-apoptotic proteins are BH1 to 4. Pro-apoptotic proteins are BH1 to 3. Sensor proteins are BH3 only proteins. Okay. These sensor proteins, along with activating the pro-apoptotic proteins, they are going to inhibit the anti-apoptotic proteins also. So basically, they are going to inhibit the BCL2, BCLXL, and MCL1. Those are the anti-apoptotic proteins. Okay. So what is going to happen if there is activation of the backs and back? These backs and back, they are going to form oligomers. They are going to form oligomers in the mitochondrial membrane. Okay. So these backs and back, they are going to form oligomers, and with the help of, by creating these oligomers, they are going to produce. They are going to create some membrane pores in the outer mitochondrial membranes. Okay. And through this pore, now the cytochrome C can come out of the mitochondria. Okay, so basically this backs and back, they're going to form pores in the mitochondrial membrane, and that will cause release of cytochrome C into the cytoplasm. Okay, so cytochrome C is there in the cytosol. In the cytosol, cytochrome C is going to, it is going to react with another molecule that is known as APAF1. Okay, so cytochrome C along with APAF1, it is going to produce a hexamer. It is going to produce a hexamer that is known as apoptosome. That is known as apoptosome. Okay, so what is APAF1? APAF1 is apoptosis activating factor. This is apoptosis activating factor. Okay, so once cytochrome C is in the cytosol, it is going to organize with APAF1 to produce the apoptosome. Okay, and this apoptosome can cause activation of certain caspases, especially the caspase 9 in case of intrinsic pathway. This apoptosome is going to activate caspase 9. Okay, so basically these caspases will be present inside the cell in an inactive form. And this apoptosome can cause activation of the caspase 9 to active caspase 9. So basically, this is the caspase 9 in its active form. Okay. So for intrinsic pathway, this caspase 9 is known as the initiator caspase. It is the initiator caspase. Okay. And as I have told previously, these caspases at their active site, they are going to have a cysteine residue, and they can only cleave polypeptide chain after the aspartic acid residue. Okay, normally this caspase 9 is kept in an inactive form with the help of a inhibitor that is known as inhibitor of apoptosis. Okay, as you can see here, IAP means inhibitor of apoptosis. Normally, caspase 9 is kept in inactive form with the help of this IAP protein. That is nothing but inhibitor of apoptosis. But what happens here? In this condition, when the intrinsic pathway is activated, along with release of cytochrome C from the mitochondria into the cytosol, the mitochondria is also going to send some other molecules into the cytosol. And these are known as SMARC bar Diablo. Okay, so this SMARC bar Diablo, they are going to come into the cytoplasm, and this SMARC Diablo, they are going to inhibit this IAP. Okay, so basically all this process is causing activation of the caspase, and I told previously, whatever may be the mechanism, there will be ultimately there will be activation of the caspases. Okay, so how it is causing activation of the caspases? First of all, it is sensing that this cell has to undergo apoptosis because it doesn't have survival signal, and it has certain, certain kind of stress, which should cause apoptosis of the cell. So basically, these sensors are going to find out that this cell has to undergo apoptosis, and once they find out that thing, they are going to activate the pro-apoptotic proteins, and they are going to inhibit the anti-apoptotic proteins. Pro-apoptotic proteins include the backs and back. These backs and back, they are going to oligomerize, and they are going to pore formation. They are going to form the pores in the outer mitochondrial membrane, and that pore is going to release cytochrome C from the intermembrane space into the cytosol. Once they come into the cytosol, cytochrome C is going to organize with APAF1, that is known as apoptosis activating factor, and they will form apoptosome. This apoptosome will cause activation of the caspase 9 through autocatalytic cleavage. So basically, these caspases through autocatalytic cleavage, they will become active. Okay, so this apoptosome, it will cause activation of the caspase 9. That is the initiator caspase in the intrinsic pathway. Normally, caspase 9 is kept at inactive state with the help of a molecule that is known as IAP, that is otherwise known as the inhibitor of apoptosis. In this process of in this intrinsic pathway, this mitochondria is also going to release some molecules which is going to inhibit this IAP. Okay, and through this pathway, it is indirectly activating the caspase 9 also. Okay, basically, this mitochondria will produce MAC Diablo, which is going to inhibit the inhibitor of apoptosis, and ultimately it will cause. Ultimately, all this process is going to cause activation of the caspase 9, which is the initiator caspase for intrinsic pathway. Okay. What happens after this? After this initiator caspase is going to activate some executioner caspases, execution caspases, and this execution caspases will ultimately cause the process that I have already described. They are going to cause activation of various other proteases and DNases that will ultimately cause the cell death. Okay. We'll discuss about the execution pathways separately because for both intrinsic and extrinsic pathway, the execution pathway is similar. So that is why first we'll discuss how the initiator caspase is activated in both the pathways. Then we'll discuss how the execution caspases are activated and what is going to happen after that. Okay, so this is the mechanism. This is the intrinsic pathway, and otherwise known as the mitochondrial pathway, because mitochondria has a dominant role in this pathway. Now we'll discuss the extrinsic pathway, or otherwise known as the death receptor pathway. So as I have told you, it is actually caused by activation of certain cell membrane receptors, which are known as the death receptors. What are the important death receptors that you have to remember? Basically, these are TNF superfamily receptors. And one of the important death receptor among the TNF superfamily is TNF receptor 1. TNF receptor 1. And there is one related receptor that is known as the FAST receptor. Okay. And this FAST receptor has very important role in activation of extrinsic pathway in various cells. Okay. And this FAST receptor is otherwise known as CD95. CD95. Okay. And also CD95 is a marker. It's a molecular marker for apoptosis. So that is also you have to remember. Okay. So basically, these death receptors, they are predominantly from the TNF superfamily receptors. And one of the important TNF superfamily receptor is TNF receptor 1. And FAST is another receptor which is very much similar to the TNF receptor 1. Okay. So, and all these receptors, they help in the process of extrinsic pathway of apoptosis. What are the ligands for these receptors? The ligands are very simple. I mean, these are either TNF. TNF is the ligand. Tumor necrosis factor is the ligand for TNF receptor 1. And for FAST receptor, it is the FAST ligand. It is the FAST ligand. Okay. As we have discussed in the hematology section, when the T cells are activated, especially the cytotoxic T cells. Okay. So basically, whenever the cytotoxic CD8 positive T cells are activated, they are going to express this FAST ligand, and through this process they can cause death of the affected cells. It can cause apoptosis of the affected cells. Of course, it can cause damage to the cells with the help of porphyrins and granzymes, but this is also another mechanism by which they can cause death of the affected cells. Okay. So once these receptors, once the ligands are bound to these receptors, multiple receptors are going to come together. At least we need three receptors together. Actually, these receptors at their cytoplasmic site, they will have a death domain. As you can see here, this is the death domain for the TNF R1 receptor or the FAST receptor. Okay, so they will have a death domain at their cytoplasmic site. Once three or more receptors are combined, their death domains will attach to each other. Okay, and once their death domains are attached, they can cause activation of another molecule, another protein that is known as FADD. What is this FADD? This is nothing but FAST associated death domain. Okay, once multiple death domains of three or more receptors are combined together, they are going to activate another adapter molecule. Okay, so this is actually adapter protein that is known as FAST associated death domain. This adapter protein is going to cause activation of initiator caspases in the extrinsic pathway. And the initiator caspases in the extrinsic pathways are caspase 8 and caspase 10. Okay, so caspase 8 and caspase 10, these are the initiator caspases in the extrinsic pathway. This adapter molecule, once it is activated, it is going to cause autocatalytic cleavage of caspase 8 and 10, and it is ultimately going to cause active caspase 8 and caspase 10. Okay, so these are the initiator caspases, and through this mechanism, these initiator caspases are activated. And the further mechanism, like activation of the executioner caspases and ultimate death of the cells, is similar for both intrinsic and extrinsic pathway. One more point you have to remember here is, what is the inhibitor for this caspase activation? In the extrinsic pathway, the regulator or the inhibitor is flip molecule. Okay, so basically this flip molecule is going to inhibit the interaction between the initiator caspases and the FAD protein. Okay, so that is the normal function of the flip protein. And if the cell is producing more and more amount of flip protein, it is going to inhibit the extrinsic pathway. Okay, so this is how the extrinsic pathway happens. And here the initiator caspases are caspase 8 and caspase 10. Now that you have understood how the initiator caspases are activated in both the pathways, now we'll understand what is going to happen next. So may it be intrinsic pathway, as I told you, intrinsic pathway, it is going to activate the caspase 9. And the extrinsic pathway, it is going to activate caspase 8 and caspase 10. These are the initiator caspases. Once initiator caspases are activated, they are going to activate executioner caspases. Executioner caspases include caspase 3 and caspase 6. Okay, so these are the executioner caspases. And I have told you already, once these caspases are activated, they are going to activate further proteins. I mean, they are going to activate further enzymes, various proteases, phospholipases, and DNases. So basically, these are endonucleases. Okay, and I have told you, once these are activated, they are going to cause fragmentation. I mean, they are going to cause proteolytic digestion of the cellular organelles, cellular proteins. Also, there will be chromatin condensation, chromatin fragmentation, nuclear fragmentation, formation of cytoplasmic blasts, formation of apoptotic bodies, and ultimately phagocytosis, which is named as efferocytosis. Okay. The next thing is, now you have to understand how the macrophages are going to identify these apoptotic bodies. So basically, once the apoptotic body is formed, there will be some kind of changes. What are those changes? First of all, these apoptotic bodies, as you can see here, this is the apoptotic body. This apoptotic body is going to produce some soluble factors. It is going to form, it is going to produce, or it is going to release, going to secrete some soluble factors. These soluble factors is going to recruit the macrophages. It is going to recruit the macrophages, so that macrophages now can come towards the apoptotic bodies. Okay. The next point is, it is going to cause expression of, I mean, there will be deposition of various proteins over this apoptotic bodies. One of the important protein is C1q protein. So C1q is a complement protein. This we have discussed when we discussed about the complement protein. So basically, the C1q, it's a type of complement protein. It can come and it can bind upon the apoptotic bodies. Apart from this C1q, there can be deposition of antibodies. There can be deposition of antibodies over the apoptotic bodies. Next point is, sometimes there will be flipping of some of the proteins. Those are present on inner side of the cell membrane. For example, phosphatidylserine. So this is actually a phosphatidylserine molecule, which is usually present on the inner side of the cell. But once the apoptotic body is formed, there will be flipping of this phosphatidylserine from the inner side to the outer side of the cell membrane. Okay, so basically this phosphatidylserine will come to the outer side of the cell membrane, and all these things, C1q, phosphatidylserine, and the naturally occurring antibodies, as they are present on the apoptotic bodies, now this macrophage can identify all of them and it can actually engulf the apoptotic body. Okay, so once apoptotic body is formed, it is going to release soluble factors which will recreate the macrophages. It will recreate the it will recreate the macrophages to the site of apoptosis, and at that site, it is going to make the apoptotic body more palatable by depositing various materials, various proteins over the apoptotic body. These are complement proteins, C1q, certain naturally occurring antibodies, and also there will be flipping of important proteins which are usually present on the inner cell membrane. Now they are going to come to the outer side of the cell membrane. All these things will help macrophages identify these apoptotic bodies, and ultimately they are going to cause phagocytosis. Okay. Important point to remember is this phosphatidylserine can be identified by a marker that is known as annexin 5. Okay. So I'll just show on the other side. So if you see here, this is a phosphatidylserine molecule which is come to the outer side of the cell membrane. Now this can be identified by a marker. Can be identified by a marker that is known as annexin 5. Annexin 5. So with help of annexin 5, you can identify the apoptotic bodies. Okay. So basically, this is known as the eat me signal because these apoptotic bodies, they are giving various signals to the macrophages to come and eat itself. Okay. So now we have discussed the entire process of apoptosis. Now we'll discuss some of the examples of apoptosis. Basically, apoptosis, it can happen in physiological situations. It can also happen in pathological situations. Unlike necrosis, necrosis is always pathological, but apoptosis can also happen physiologically. Especially, we'll discuss various examples how apoptosis helps in normal physiology and normal homeostasis. The first example is removal of supernumerary cells. So this we can understand during the process of development. As you can see here, if you see development of the hand, you can see here this is the limb bud. As you can appreciate here, now you can appreciate that there are presence of interdigital tissues between the developing fingers. Okay, so between the developing fingers, you can find there is presence of interdigital tissues in the fetal hand. These interdigital tissues can be removed with the help of apoptosis. Okay, with the help of apoptosis, these interdigital tissues can be removed and ultimately they can form fully functional fingers or the digits. And if there is a defect in this process, if there is defect in apoptosis of this interdigital tissue, that is going to cause syndactyly. That is going to cause syndactyly. That means incomplete separation of the digits. Okay, so this is what normally happens during the process of development. So that is the first point. The second one is involution of hormone dependent tissue upon hormone withdrawal. So this is, the classical example that you can remember is the menstrual cycle. The classical example is menstrual cycle. So during menstrual cycle, sudden withdrawal of gonadotropins is going to cause apoptosis of the endometrial cells. That is going to, that is going to come out of the body as menstrual flow. Okay. So the classical example menstrual cycle in which there will be involution of hormone dependent tissues upon hormone withdrawal. The third thing is cell turnover in proliferating cell population. Actually, this we have already discussed when I discussed about the thymus and the T cell development. When I discussed about the thymus and T cell development, I have told you there is something known as positive selection. Positive selection. So basically, positive selection happens in the thymic cortex. Okay, in the thymic cortex, those developing T cells, which are not going to identify the MHC molecules, those T cells are going to die. Okay, so those T cells are going to die if they cannot identify the MHC molecules. Okay, and those cells will die with the help of this apoptosis. Okay, so in the process of positive selection, the cells which are those developing T cells which are identifying MHC molecules, those cells will be positively selected, and those T cells which cannot identify the MHC molecules, they are going to die through the process of apoptosis. Okay, the fourth point is elimination of harmful self-reactive lymphocytes. This also we have discussed when I discussed about the T cell development inside the thymus. I have told you in the thymic medulla, when the developing T cells, the single positive T cells, if they identify the self antigens. If they identify the self antigens, those self-reacting lymphocytes have to die inside the thymus itself, and they will die with the help of apoptosis. Okay, so they will die with the process of apoptosis, and that is known as the negative selection. That is known as the negative selection. Okay, so for the T lymphocytes, negative selection happens in the thymic medulla. Okay, and also we have discussed when I discussed about the lymph node, I have told you that when the B cells are activated in the germinal center, and if those B cells is going to react with the self antigens, those B lymphocytes has to undergo apoptosis, and I have told you follicular dendritic cells help in that process. Okay, so whatever it may be T lymphocyte, it may be B lymphocyte. If they are going to identify, if they are going to react against the self antigens, they are going to die. They have to die with the process of apoptosis. The last point is death of cells after the purpose. So, for example, there will be release and activation of neutrophils during the process of acute inflammation. And once the process of acute inflammation is over, these neutrophils, which have served their purpose, they are going to die with the process of apoptosis. Okay, so these are all the examples. These are all the examples which are happening physiologically in our body, and in all this process, apoptosis is going to play a major role. Okay. Now we'll discuss apoptosis in pathological condition. So basically, apoptosis is going to eliminate cells that are injured beyond repair. So basically, if a cell is injured, it will try to repair itself. But if it cannot repair itself, it has to die. Otherwise, it will be detrimental for the body. And this death happens with the help of apoptosis. There is one more beautiful concept that we have to understand, that, as I have told you previously, the macrophages, when they engulf the apoptotic bodies, they are not going to produce any inflammation. Unlike necrosis, apoptosis is not associated with inflammation. And because it is not associated with inflammation, there will be no host response and there will be minimal collateral damage. So basically, apoptosis that is happening in pathological conditions, this is actually a kind of host defense in which the body is eliminating those cells which are injured beyond repair, and it is not causing, it is causing very minimal host response. That is why it will have very minimal collateral damage. Okay, what are the examples? The first example is DNA damage. Okay, so first example is DNA damage. The DNA damage can happen because of radiation. It can happen because of radiation. It can happen because of cytotoxic drugs, cytotoxic chemotherapy, and also sometimes various mutations can alter the DNA structures. Okay, so all this process will ultimately cause activation of the apoptosis and death of the cells. Second point is accumulation of misfolded proteins. Okay, so whenever there is accumulation of whenever the misfolded proteins are accumulated, usually they are going to activate the proteasomal pathway. Okay, they are going to cause ER stress, endoplasmic reticulum stress, and through this process they are going to activate various mechanisms by which there will be reduced production of misfolded proteins and increased repairing, increased folding of the there will be proper folding of the misfolded proteins. Okay, so this happens with the help of endoplasmic reticulum stress. But whenever there is excessive production of misfolded proteins, whenever there is deposition of excessive misfolded proteins, this endoplasmic reticulum stress is going to activate the process of apoptosis. Because if this doesn't happen, there will be abnormal accumulation of misfolded proteins inside the cells, and that is going to cause various pathological conditions. Okay, the third point is virus infection. Okay, so if the virus, any kind of infection can cause apoptosis of the cell. However, it is classically described for viral infections. In these conditions, these viral infected cells can be identified by the cytotoxic T lymphocytes. And we have also discussed previously when we discussed about the activation of the T cells. The activation and the mechanism of T cell activation, and in that lecture, I have told you how the cytotoxic T lymphocytes can identify the virus infected cells with the help of MSA class 1 molecule, and they can damage the cells. Okay, basically they will cause apoptosis of the cells by two mechanisms. So if you see, this is a viral infected cell. First of all, they can release, they can cause pore formation with the help of porphyrins. Through this pore, they can release, through this pore, they can cause entering of various proteins like granzymes into the cell, and those granzymes inside the virus infected cells that can initiate the process of apoptosis. Along with that, the cytotoxic T lymphocytes will have fast ligand in their cell membrane. This fast ligand can interact with the fast receptors that are present on the viral infected cell, and through this process also they can cause activation of the apoptosis, basically the extrinsic pathway of the apoptosis. Okay. And the last example is pathologic atrophy in parenchymal organs after the duct obstruction. So basically, this is found in case of pancreas, parotid gland, and kidney. So in these organs, because of the duct obstruction, proximally it is going to cause parenchymal atrophy. It is going to cause parenchymal atrophy. So these are some of the examples of pathological conditions in which apoptosis is playing a major role. Okay, so that is all about apoptosis.